Hey everyone, it's Dr. Rick, and it's time for Dr. Rick's Sunday Q&A. And I've got 3 questions that came up this week that were outstanding. The first one was, what do I do when I have pain to my tummy? Is it heart pain? Is it something else? Is it dangerous? And this is the area, hopefully you can see that, where my patient was specifically pointing. Number 2 is I have pain to my right hand, especially the thumb, and now the other thumb is hurting and the knee is hurting. So is that arthritis? That comes from a middle-aged person. Number 3 would be, when do I consider using medical cannabis, specifically CBD, and adding that to the treatment plan? So number 1, as far as abdominal pain, there's an algorithm that we use in medicine, and it falls whenever we do Q&A, questions and answers for patients. We try to extract as much information without getting the patient exhausted from questions and answers, and come up with a diagnosis, and then perhaps a working diagnosis, and perhaps add more testing to hone in the diagnosis and come up with a specific treatment plan so that we can reverse suffering. That's just the algorithm of Western medicine. I think that with modern day medicine, visits are very timed, and in many cases, as soon as we hear a couple of choice words, buzzwords, the diagnosis is already assumed, and then the algorithm for a workup is made, which I don't necessarily agree with, because I think even if the concept of a diagnosis is usually going to be kind of the same symptoms, I still think everybody manifests things individually, and with all the complex medical problems that the multitude of different diseases that most people have, I think that it will present differently, and it has to be fine-tuned. So I still say it's very worthy to get a history, a full history and physical. I'd say 80 to 90% of the time, I can come up with a pretty decent diagnosis based on the symptoms. I'll do a physical exam to hone that in, and I might order tests to further narrow down the diagnosis. The problem comes when you have stomach pain and you're older. There are some emergencies that have to be considered, and let's go down the stairs. In a lot of cases, the emergencies could be abdominal aortic aneurysm, or oh, there goes my light. Abdominal aortic aneurysm, or ruptured ulcer, or problems with say just a regular gastritis or ulcer, or even sometimes referred pain from a typical heart attack. It can be that way. So anything in the stomach can be that way. It's up to the clinician to figure out the details with the right questions, and then hopefully the right answers are given. And then we go down the algorithm using that computer that we have in the brain and the experience that we've learned to come up with a treatment plan to stop suffering. So, and this is my lake, by the way. Not my lake, we share this lake, but I have to tell you a story one day about how we came across this house. However, I think it's important to, if it's a young person that comes in with abdominal pain, I'd probably say it can be, probably be okay. If it's an older person, I'd have to look out for that abdominal aortic aneurysm. Usually an ultrasound would give you an answer immediately. And physical exam would also help. If it's a middle-aged person, 30 to 50 or 60, gastritis will be there. The United States is so full of people with reflux, gastritis. We're eating the wrong foods. We've got too much stress. We eat and then lie down. I think that's number 1. But of the 4 things, stomach, heart, lung, and chest wall, that includes back too. Of the 4 things that are there, for an average person, not including that abdominal aortic aneurysm, we always have to, even if it doesn't sound right, we always have to rule out the heart first. That's the worst case scenario, because if that's missed, it's life-threatening. And then all the others. But most of the time, it's going to be stomach. So that's how I come up with a treatment plan, or at least a Q&A, and then come up with a diagnosis and then hone it down. But then there could be people who have 2 things at the same time. But again, it depends on the specifics of what person's going through, kind of changes they've been going through with this COVID crap. Everybody's kind of overeating and too stressed out. A little bit of alcohol, a little bit of coffee, the perfect setup. Even if you're not used to, or even if you're used to having wine and coffee and have a little bit of stress or not get bothered, it's just the right elements, the right ingredients make this recipe highly possible for ulcers, gastritis. And there's a treatment plan for that. I think I have a video somewhere. The second question, as far as joint pain, especially hand. So the number, again, Occam's razor said we go with the usual, the highest possibility. And highest possibility for joint pain is overuse, no matter which age. So it always depends on what you do. Are you right-handed or left-handed? Was there a trauma associated with it? Is there overuse from work? Something new that you've been investing in? So typically when you have an inherited arthritis, a genetic arthritis like rheumatoid arthritis, you'll have symmetrical, meaning the thumb on this hand, the thumb on the other hand, the fingers, the four fingers on this hand, the four fingers on the other hand, both knees. Usually have symmetrical hits, and it'll include aches and pains, swelling in the morning. Usually the complaint is stiffness in the morning, and then it gets better as a couple hours goes by. So how do we tell? Well, we feel the joints, take pictures or x-rays, sometimes take blood tests to look for details, and it'll again hone us into that. But I'll be doing a video on cat's claw and turmeric. I've done videos on turmeric already, but there's a couple things that you can do. And again, I think it really hones down to don't doing anything further as far as overuse, but also changing food. I really think there's a lot of low-grade food allergies or food intolerances that add to pain. And if it causes inflammation in the heart, you know it's going to cause inflammation in the joints, so why would you continue with that? But typically we're not told that, or the food and the preservatives are all disguised, and or the allergies, the intolerances are just low grade. So I didn't realize that engine was making a lot of noise. Hopefully you can hear this. But sometimes when you accumulate 3 to 4 different foods that usually you'd be able to tolerate, but you have them now all together, or they keep on happening simultaneously throughout the week, that's one hit, and then your body recovers, and another hit and your body recovers, even if it's not the same food group. If it's lectins and gluten and dairy, you know, back to back to back, and then alcohol, that's not good. Eventually the body will not be able to have some downtime to recover, and then it's going to manifest as pain, arthritis, swelling, immobilization, nighttime awakening. So even if you have a genetic history, you have to be on your guard. You got to be doing the best you can. Full range of motion, muscular endurance, flexibility. If you don't have a history in the genes of previous arthritis, rheumatoid, or even scleroderma, osteoarthritis, then you still have to watch yourself. And unfortunately, 40% of America is overweight, so that usually means there's too much food. And where there's too much food, there's obesity, overweight, there's going to be a joint problem sooner or later. So it behooves you to, if you're moving to a body mass index, which unfortunately I see a lot of, greater than that sweet spot of 23 to 25 body mass index, you're already at risk. If there's an insulin resistance issue, fine. If there's a true diabetes issue, fine. If there's a cholesterol issue, work on it. So all these markers are there to help you figure out where you are right now and give you an answer to, or at least a goal to hit, to move out of this dangerous situation. Because if you don't do anything, one thing is guaranteed: age will accumulate your damages, and you don't want to be walking into the age of 60 with 3 different unanswered damaged or diseases. They just really will cause a disability. It will not. Diabetes, for example, is a terrible way to go, because it doesn't kill you with one swift stroke. You get chopped off legs, you get high blood pressure, you get a little bypass or a stent, and then you have another problem. You have numbness and tingling, you have problems with your thinking. Even Alzheimer's is considered type 3 diabetes, so it's slow death. And I think that we have a lot of walking wounded in the United States. Then there's COVID, so you have to kind of pick up the pace, realize where you are. Even if you're not having any symptoms, just look on a scale, look at the metrics that your doctor gets, and see. So in a roundabout way, arthritis is a reflection of something going on inside, and usually it's not necessarily genetic. Most of the time it's attained because of what we do, what we eat, the sleep that we're getting poor, and the stress that we're giving unanswered. So hopefully that gives you a kind of an idea. And I do think that even if you have the genetics, if it runs in the family, there's ways to increase your chances of expression of the gene. There's ways to repress and decrease the chances of expressing the gene. So it all comes down to healthy living, even though you're not having any symptoms. And you don't have to be a millionaire to be healthy living. It can be done frugally, but you just need the keys to know, be inspired to make the change. That means your doctor has to get the tests done. Last question would be CBD. I think CBD, medical cannabis, is excellent. I think that my colleagues still have an issue with using anything that sounds like it says marijuana or cannabis in the name, but it is a medicinal plant. I mean, if you need it for PTSD and perhaps sleep, I'd say try it. You have to be very careful because the medical cannabis of today is much more potent than the 70s and 80s. So you have to be given the right formula of what to try first and how to ramp it up. If you have inflammation, definitely. Crohn's disease, definitely. Ulcerative colitis, definitely. Arthritis, definitely. Even if you have irritable bowel syndrome and gastritis, I still think it can be used with just as much potency as some of the medicines that we're prescribing, my colleagues are prescribing. So you just have to know how to use it. CBD, by the way, it is very slow in onset. It's subtle, but it does kick in after about 6 weeks. And most people will try for 2 weeks and say, it doesn't help me, so I'm not going to take it anymore. But you have to know how to blend THC, CBD. You have to know how to use your products, how often you have to take another dose of the products, side effects of those doses, and then what to watch out for in case you have a bad high. So obviously with the medical cannabis, there's always the chance that you will have the THC heavy side effect of being high. But again, there's also that with Flexeril, a muscle relaxer, or Tramadol or Norco, pain control medicines. There's always a chance that you'll be out. So the possibilities are there. Even with Zoloft, Paxil, Prozac, they do work to reverse disease, make you feel better, get your serotonin high, but there's always a chance that you might have the wrong side effects. So it's not just medical cannabis. I mean, there's more side effects with prescription medicines than there are with medical cannabis. So I think it's worth it, but number one, the doctor that gives it to you has to be well versed. Number two, doctor has to be not prejudiced to think that you're just a drug abuser. Three, you also have to have the dispensary to give it to you and guide you properly, because if you get the wrong stuff, you'll be throwing it away and throwing away a lot of money and experimenting over and over again without making a journal. Now, see all my videos for medical cannabis because I think it's a great product. I think it's great medicine. But again, it has to be used properly and expectations have to be real. So hopefully this gives you guys a little bit of a hint of what the kind of patients I see in the clinic, and maybe some guidance that your docs aren't giving you. It's always down to lifestyle, and I think that's what integrated medicine does. It gives people ideas about lifestyle change to change the cause of the problem and not just band-aid the effect. So don't forget to subscribe to me on my YouTube channel. Hopefully you see me. I don't know if that noise was too loud or if it's too dark out, but subscribe and I'll see you at the next Sunday Q&A.